So for today's topic, we will be discussing about the nutritional and food requirements of infants, and along with that, we'll discuss the topic of preschoolers as well later. So those who have the new textbook, it's on page number 57 in dietetics, page number 57. Those who have the old textbook, it's page number 54. Those who are joining late, please help them out with the page numbers. Please connect to your audio, only then you can listen to the voice. Is the screen visible? Am I audible now? Okay. So starting with the topic of nutritional and food requirements of infants. So growth and development during infancy, if you just see the pictures also which we have shared here, most rapid growth takes place during the infancy. When the child is born, within that 6 months, okay, within 6 months, you can see the child has to double the weight. Okay, by the first year of life, the child has to triple the weight. Okay, so that's a challenge there, that the breastfeeding mothers, the caretakers, and the parents have to make sure that by the age of 6 months, the child is able to double the weight of whatever weight the child was at the age of at birth, 2.5 kg or 3 kg. Okay, by 6 months, the child has to double that weight. Okay, so we can understand a very rapid growth and development takes place in that initial first year of life. A healthy newborn is around 3 kg to 3.2 kg. In India, 3.2 or 3 kg is considered as to be healthy. Most of the kids are between 2.5 to 3 kg. And India also suffers from a lot of low birth weight baby issues as well, because of the malnourishment seen in mothers, teenage pregnancies. Okay, these are the other reasons, external factors that could lead to low birth weight babies or small for gestational age babies. So the weight doubles by 6 months. By the end of 6 months, the weight of the child has to double, and it triples by the first year of life. Okay, by first birthday, the child has to have triple the weight what the child was having at birth. Coming to the nutritional requirements, energy in a very generalized statement, energy requirement is about 92 kilocalories per kg body weight. Okay, this is required for any growing child. And also, when you compare it, this particular calories to an adult's calorie is much lesser. Okay, 32 kilocalories per kg body weight is what an adult requires. But here for the infants, you can see it is around 92 kilocalories per kg body weight. Okay, and it is a range. Okay, so it's a range for 6 months old baby, 98 kilocalories per kg body weight. Okay, and for the child who is between 6 to 12 months, okay, approaching the first birthday, energy requirements falls down. Okay, slowly energy requirements falls down. The initial stages, you have to keep up such a high energy requirement because the child has to put on weight. Okay, so the child who is around 0 to 6 months of age, 92 or 98 kilocalories per kg body weight. After 6 months of age, 80 kilocalories, and slowly the calorie intake has to come down, because when it comes to adult, it is just 32 kilocalories or 30 kilocalories per kg body weight. Protein requirement, it is 1.6 gram per kg body weight, and this requirement is met exclusively by the mother's breast milk for the first 6 months of life. And after that, when you introduce weaning diet, protein has to be taken care of. Protein content of the food is taken care of. Fat and essential fatty acids, 19 gram per day of visible fats. Visible fats you can use only after the child has reached the weaning stage. Okay, but before weaning or up to the 6 months, first 6 months of age, visible fats and essential fatty acids, these are the main components of the mother's diet, lactating mother's diet. Okay, so lactating mother has to make sure that she is having a diet that is rich in essential fatty acids and it has good fats. That is a responsibility of the lactating mothers, because fat, vitamin B complexes, okay, they do travel from the mother's nutrition to the through the breast milk to the child. Okay, and after the weaning, after the once the weaning age has approached, once you can add more home cooked meals, visible fat, the control of visible fat that goes into the child's diet is completely in the hands of the caretaker. Okay, usually whatever khichdi or whatever smashed food that you prepare, soup or whatever smashed food, boiled and smashed vegetables you prepare, if you want to increase the calorie count of it, you just have to pour 1 teaspoon or half teaspoon of ghee or any other visible fat that you use onto that before feeding the child. So without increasing the bulk of the food, you can increase the calorie count of the food. Excess protein, to having too much of protein will be harmful for the child's health as well. So that has to be taken care of. Not too much of protein has to be given. And human breast milk is able to give at least 50 to 60% of essential fatty acids, whatever is required. 50 to 60%, majority of it is given by the human breast milk. Calcium and phosphorus. So in 700 ml of breast milk for the first 6 months, and there is an intake of 700 ml of breast milk for the first 6 months, and after that 600 ml for the next 6 months up till the age of 1. Okay, so and in this particular range, when you take the consideration of 700 ml and 600 ml per day, if that is what the child is taking, okay, around 300 mg of calcium and 450 mg of phosphorus is definitely the child is able to meet it. But apart from that, the mother's diet should also follow up with the same high calcium and phosphorus content. Otherwise, if the mother does not have a calcium or phosphorus rich diet, her bones will undergo demineralization just to provide nutrition to the nutrition towards the breast milk. The mother's bone will undergo demineralization. So to prevent that, the mother's diet has to be high in protein, calcium, vitamin D, phosphorus, etc. Iron requirement 46 microgram per kg body weight. And at birth, the child's body already has enough amount of iron, because during pregnancy, the child's liver and other soft body tissues were collecting iron from the mother's nutrition. The growing fetus is collecting iron from the mother's nutrition, and breast milk does not provide iron content. Okay, so for the first 6 months, for the child to survive, okay, iron is there, or the child's body has the reserve of iron for the first 6 months. After that, when the weaning foods are introduced, you have to introduce iron rich food as well. So during the first 4 months, the baby's blood volume doubles. The concentration of iron and hemoglobin also falls from the at birth. What was the hemoglobin level for the child? By the age of 4 months, it definitely falls, because the iron reserves are getting used up. Okay, and when the child's birth weight doubles at the age of 6 months, without depleting the essential iron stores, slowly now you have to start introducing more and more iron rich food into the diet. So that's why that's how you will prevent early onset of anemia in the growing child. Zinc, sodium, and iodine, whatever the breast milk is supposed to provide, breast milk has adequate quantity of this. All these minerals are in adequate quantity from the human breast milk. So breast milk can take care of zinc, sodium, and iodine content. Vitamin A, 350 microgram is the requirement, and the vitamin A content of breast milk is completely sufficient for the child's growth and development. And after 6 months, definitely yellow, orange fruits and vegetables, boiled and smashed, or if it is just fruits, then smash the fruits, make a puree of fruits, okay, mango puree or a papaya puree, any purees of fruits can be given. And if it is vegetables like carrots and all, okay, boil and smash the carrots and provide it to the child. Okay, smoothies can be given to the child. All the yellow, orange fruits and vegetables can be given. Vitamin D, again, to retain enough amount of calcium and phosphorus, vitamin D requirement has to be maintained. Uh, Neither human milk nor the cow's milk, if the child has lost the mother or anything like that, and the child could not be put on breast milk, then cow's milk is the next substitute for it. Okay, so the vitamin D content, vitamin D is definitely present in human milk as well as cow's milk, but it is not in sufficient amount. Okay, so the good supply of vitamin D during pregnancy has to be ensured. So it benefits the mothers as well, so that she does not lose the calcium content from her food. For the essential absorption of calcium from the diet in the intestine, vitamin D has to be present. So vitamin K, at birth, vitamin K injection is given. Okay, a 1 mg dose of vitamin K exactly at birth. As soon as the child is born, vitamin K injection is given to the child, so that vitamin K is a blood clotting factor. Okay, so to prevent any blood loss or to prevent any excessive bleeding out in the child, vitamin K dosage is given. Intramuscular injection is given to the child at birth. Okay. And if the mothers are deficient in vitamin K, or if the mothers are, because of their any health condition, if the mothers were put on anticoagulants for a pretty long time, there are high chances that vitamin K deficiency may happen in the children and the newborn babies as well. So single dose of 1 mg of water miscible vitamin K is given to the child soon after birth. That is appropriate, that that can take care of the child's vitamin K requirement. Vitamin B complex completely depends on the mother's diet. Okay, first 6 months completely depends on the mother's diet. After that, vitamin B complex rich foods can be incorporated into the infant's diet as well, like groundnuts and peanuts. Okay, if the child is not allergic to it, groundnuts, peanuts, these can be smashed into various preparations and given, because it adds good fat. Okay, it adds good fat, essential fatty acid. It adds a good amount of calories, healthy fats, protein. Along with that, all the majority of the vitamin B complexes are also given to the child. And it is rich in minerals also, all the other micro minerals. Peanuts and groundnuts are rich in that as well. So incorporating peanuts on a daily basis for the child is a good strategy to improve their calorie intake, to put on the weight as well. Vitamin C, human milk contains twice the amount of ascorbic acid as compared to cow's milk. Okay, twice the amount of vitamin C is present in human milk as compared to cow's milk. Okay, but it is present. There is a difference. It is not a good source. There is vitamin C present, but it is not a good source. Okay, and a very little reserve of vitamin C will be present in the child in the initial first 6 months of age. The complete antioxidants and the antibodies that the child gets, it's from the mother's immunoglobulins and other components in the breast milk. Vitamin C reserve is very less. Only after the 6 months of age, when the fruits are being introduced, citrus fruits, fresh fruits, fruit juices are being introduced, only then the vitamin C level in the child will increase. The blood serum levels. Okay, vitamin C cannot be stored in the body. It's water soluble, so it is taken away from the body on a daily basis through urine. The nutritional assessment, the eye card, thigh card, mother and child card is given to the mothers at birth, and every month once the child has to be brought to the PHC or towards a pediatrician, their height, weight. Okay, up till the age of when the child is able to stand up properly on its own, the length of the child will be measured, weight of the child will be measured, all the milestones. Okay, is the child able to control its own neck movements, head movements, grasping, holding, grabbing, leaving any items. Okay, these are the childhood milestones. Okay, forming sentences, forming words, trying to crawl, rolling themselves or themselves on the stomach on their own. Okay, these all are milestones. So as a part of nutritional assessment, all these milestone assessment will also be done at a PHC level or at the pediatrician's office. So these are the nutritional requirements that has to be focused. Slight variations you may find as compared to the new book and the old book, but there is not major difference in these numbers. Okay, is it clear so far, the nutritional requirements? Next is the food requirements. Food requirements for the infant for the first 6 months is completely human milk, that is breast milk. Okay. So within half an hour of normal delivery, if it was the normal vaginal delivery, within half an hour, the child has to be breastfed. And if it is a cesarean section, C-section, within 4 hours, the child has to be breastfed. Okay. So just follow on whatever requirements you have in your textbook. Okay. Because see, these values will keep on changing. These values, as I mentioned earlier, ICMR values will keep on changing. Even the students who have new textbook, you can expect changes in ICMR in the next few years. Next year or this year also they may change. Okay. So just for your understanding, you should know the healthy range. Don't if it is given 10.5 gram of protein per day, you don't have to be very precise about it. Okay, you can take up a healthy range. You can compare the previous year's ICMR data, this year's ICMR data, and also in the future ICMR data will keep changing. Okay, because new researches, the health statistics of our country is changing. Okay, we are inching away from a population who had mortality because of poverty and communicable diseases. Now we are inching away from communicable diseases and we are inching towards non-communicable diseases. The dynamics of the Indian population is changing. Okay, the economic condition is changing. The kind of lifestyle that a middle class family has these days, and compare it to 10 years back or 20 years back, it is completely different. Okay, we are moving forward towards a very sedentary kind of lifestyle because the economy and GDP value, okay, the per capita income, these are increasing day by day. Okay, so it will have an effect on health and nutrition also. So ICMR has to keep changing this. Okay, is it clear why ICMR data change over a period of time? It is completely based on the external factors that is affecting the Indian population. Okay, 20 years back or 30 years back, the people who suffer from diabetes was not that common. Nowadays, every household has at least 2 to 3 people who suffer from any form of lifestyle diseases. It could be cardiac, diabetes, or any other lifestyle diseases. But if you take the data statistics from 20 to 30 years back, it was not the scenario. Okay, so something is changing, right? So based on that, the diet is changing. Now, only after 1992, when globalization, when the open markets of Indian markets were open for global trading, only then we got to know about McDonald's, Pepsi, Coca-Cola. Okay, only after 1992 or 1994 these things came into our country. Before that, we didn't had these kind of lines, junk food lines or food lines in the country. Okay, so yeah, a lot of shift has taken up. Specifically, the shift that has took place in the urban parts of the country is in a much higher rate as compared to rural parts of India. Okay, it's because the mother is sedated, because see, when the breastfeeding is initiated for the first time, the midwives help the mother out. Okay, the mother is helped out properly on how to hold the baby. Okay, if the baby is not able to latch properly on the nipples, okay, how she has to massage her breast to initiate the breastfeeding. If the child is not able to suck properly, what is the proper position? Because the positioning of breastfeeding is completely subjective. Okay, child has its own, every child is different, they have their own comfort zone. Some child needs to be held, some children, they just want to lie on the bed and be breastfed. Okay, so a comfortable position for the child has to be understood. Different strategies, different positions of the breastfeeding has to be taught to the mother for the first time. Specifically, if it is a primigravida, first time mothers, you have to teach all these things. Okay, so cesarean section, definitely the mother would be sedated. Effects of sedation has to reduce a bit. So we will have to wait out a little bit, but not it should not extend beyond 4 hours. Within 4 hours, the child has to be given breast milk. Okay, colostrum has to be given. And try to avoid any pre-lactal food. For example, it's very common. You must have come across this situation. As soon as the child is born, the first thing the child is given is honey or water or some holy water or something like that, based on their cultural and religious preferences. Nothing should be given. Even a drop of water should not be given to the child apart from breast milk. The first thing that enters the child's GI system should be the mother's breast milk. It should not be honey. It should not be any holy water or any regular water for that matter. No medications. Okay. Some people has this habit of doing some pujas or something for the ghee and everything, and giving that ghee to the child for the first time. Okay, so these things has to be avoided. These are pre-lactal food. Okay, these has to be completely avoided. The first thing that enters the child's body should be mother's breast milk. Okay, because the child's anatomically and physiologically speaking, the child's body, the child's GI system is made for is made in such a way to receive the breast milk for the first time. Okay. Formula feed only when it is advised. We will come to that later. Formula feed only and only when it is advised. If there is something, if the mother is on certain medication, mother is suffering from some infections, okay, in such cases, only then when the mother is unable to do breastfeeding, okay, or the mother is not present because of any emergency situation, only in that point of situation, formula feed is given to the child. Otherwise, we will come to that. We have an Indian Act on formula feeds is also has been passed. It was amended in 2003 or something. Okay, so we will come to that later in this chapter. Breastfeed even if the mother is sedated. Okay, that happens in C-section. In some C-sections, the mothers take a lot of time to come out of the sedation completely. So even if the mother is sedated, breastfeeding has to be initiated by the midwives. Nurses and the midwives will take care of this. So there is a lot of advantage of breastfeeding as well, because the first time when the mother experiences the child latching onto her for the breastfeeding, it forms the immediate emotional bond between the mother and the baby. It is also called as the kangaroo mother care. Okay, the mother has to expose her breast area, and she has to keep the child on the breast so that the child feels the warmth of the mother. So it creates an emotional bond between the mothers and the child. It's a healthy relationship bonding. Nowadays, fathers also jump into this. Fathers also remove their shirt. They experience the warmth of the child. They give the warmth of their own body to the child. So it also forms a emotional bonding between the child and the parents. Okay, that is kangaroo mother care. Promotes the baby's gut health. Breast milk strengthens the baby's immune system. We all know that all the immunoglobulins that the child gets is from the passive immunity that the child gets from breast milk. It aids in brain development as well because of the essential fatty acids present in the breast milk. So the breast milk that comes out is 3 different forms in general. The first form is colostrum. The first few days, okay, the first few days of the breast milk that comes out from the breast is colostrum. It's a thick liquid with it's called as the golden milk as well. Okay, highly rich in immunoglobulins. Colostrum is highly rich in immunoglobulins, and it is the first immunization that the child gets. Okay, even before the child gets any BCG vaccine or anything like that, within the first week of birth, the child has to get the BCG vaccine for tuberculosis, to avoid tuberculosis. But colostrum is the first active passive immunization that the child receives. Okay, so it has a lot of B12 binding protein, and for growth of the E. coli bacteria. The E. coli bacteria is a healthy, good bacteria we all have in our intestine. Okay, so to promote the growth of E. coli bacteria for the further digestion of the breast milk that is going to come. Okay, so for that, we have the B12 binding protein that enhances the growth of E. coli bacteria in the child's gut. Cholesterol provides that. It also has antibodies. Cholesterol has antibodies against viral diseases as well, such as smallpox, polio, measles, influenza. Okay, lots of healthy enzymes that promotes cell maturation for the child. Okay, that is also found in colostrum. And it has a large variety of protective substances. So at any cost, the child should not miss having colostrum. Okay, so it is almost yellowish in color. Yellowish in color. No, it's not plain white in color. It's very thick and it's yellowish in color. That is colostrum. Only it will be secreted only for the first 2 to 3 days. Okay, after delivery. And it is secreted in a very small quantity, 10 to 40 ml, because a newborn baby will not require much of the feeding. It only requires less than 20 ml of feed on a daily basis. Okay. Next, we have transitional milk. After the colostrum has been secreted, slowly the color changes from yellow to white. So that part of the time, it is transitional milk. For the next 2 weeks, okay, soon after the delivery, for the next 2 weeks, the milk increases in its quantity. The color changes from yellow to milky white. And it also has immunoglobulin. It continues to produce immunoglobulin, and it has a protein content as well. But as compared to colostrum, the immunoglobulin levels and the protein content has decreases in the transitional milk. And if you continue to provide colostrum and transitional milk without any fail, it has seen that neonatal deaths, infant mortality rate, is decreased because the child has been well fed with colostrum along with transitional milk. For the first 2 weeks, when the child is exclusively breastfed without any delay, it has shown that the infant death or neonatal deaths have reduced in ICU. Then finally, you have mature milk. In mature milk, after the first 2 weeks that has been completed, from that day onwards, for the next 1 year, or till however long the mother plans to continue the breastfeeding, it is mature milk. And even in mature milk, there is 2 types of milk that comes out. One is hint milk and one is fore milk. Okay, so fore milk is the milk that comes out first. It is clear or it is bluish. It is pale white. It's not completely. It is not like a plasma color. It is sometimes clear and sometimes bluish in color. It does has some lactose component in it, but the purpose of the fore milk is to pacify the thirst of the baby. Okay, it takes care of the thirst of the baby. So that's the reason why it is more watery in consistency, and it has low level of fat, but it still has high lactose. Okay, and since it is low level in fat, that is the reason why it is more watery in nature as compared to hind milk. Okay, so hind milk comes later for in the same breastfeeding session. For the first few minutes, fore milk is what comes out, and slowly hind milk follows up. Okay, so later in the feed, hind milk comes out, and which is much more richer in fat and protein as well. And this is supposed to satisfy the baby's hunger. Okay, fore milk will satisfy the baby's thirst. Hind milk will satisfy the baby's hunger. And the children who are fed well with fore milk and hind milk, they tend not to wake up at night at odd hours. They sleep very peacefully. Okay, and they grow healthy. And again, when it comes to breastfeeding, you cannot depend on a tailor-made breastfeeding. Every child is different. Their feeding time may differ. Okay, and the way how the child learns the sucking habits. Okay, and the child will try to adjust its hunger, and then based on that, how the child reacts for breast milk. Okay, it is completely different. So there is no perfect schedule on which you can put a mother on breastfeeding schedule. It is very subjective. Okay, so this is the snapshot of all the different forms of breast milk which we have just now discussed. Colostrum, the first few days it is colostrum, maximum for the 3 days. cholesterol will be secreted, yellowish and creamy in nature. It is high in protein, fat, soluble vitamins, and immunoglobulins. And next, for the next 2 weeks, from after the cholesterol, from 2 days to up to 2 weeks, transitional milk will be secreted, which is high in fat, lactose, water soluble vitamins, and it is high in calories as well. And after that, for the entirety of the breastfeeding session, for the breastfeeding time period that the mother follows for the growing child, it will be mature milk. So the first part of the feeding session is fore milk, second part is hind milk. Fore milk is bluish in color, whitish in color, because it has more water content, less fat content, but still it is sweet and it is high in lactose. Okay, and hind milk is comes much later, richer in, it is creamier, richer in fat, calories, and it has less sugar content in it. So it can pacify the hunger. So this is how you can see there is a shift in change. Cholesterol, which is till the first 3 days, the breast milk is somewhat in this particular color, and slowly you can see how the transition milk is changing color from deep yellow to pale yellow, and then almost white, ivory white, and then the mature milk for the rest of the breastfeeding phase, it will be the normal cow's milk colored. It is very similar. So this is the color difference which you can see. About the nutritional benefits, if you want to compare the nutritional benefits of breast milk with cow's milk or buffalo's milk, on page number 63, those who have the new textbook, on page number 63, comparison table they have provided on table 4.3. In your old textbook also, it is, I guess it is the same table number. Yeah, it is the same table number, page number 60 in old textbook. So based on that, if you go and check the fat content, okay, if you go and check the fat content, which milk has the highest fat content? Is it the human breast milk, cow's milk, or buffalo milk? So if the child has not put on, the child is having difficulty in putting on weight, okay, after the first 6 months, not in the first 6 months, okay. If the child has difficulty in putting on weight, it's better to give the child buffalo milk after the first 6 months of age, okay, so that by the age of first year, the child triples in weight. The health of the child is priority here. So instead of cow's milk, you can go for buffalo milk. Okay, based on the values, nutritional values that they have given in comparison of breast milk, cow's milk, and the buffalo milk, you can see, and as and when whatever is required, such changes can be brought into the child's diet. Okay, but for the first 6 months, it should be exclusively breast milk. Coming to the advantages of breastfeeding. Yeah, it will be digested as equally as how it will be digested, like how the other milks will be digested. Okay, if the child does not have any innate allergy or the food sensitivity towards buffalo milk, okay, the child should not have any issue with that. The purpose of having buffalo milk is so that the child is able to put on weight. Okay. Even the energy, carbohydrate requirement, okay, the calcium content, phosphorus content, all these content are much higher in buffalo milk as compared to cow's milk. Slowly, once the child has crossed the infancy or the child has crossed the toddlerhood in a healthy way, you can shift the milk back to cow's milk. Okay. So nutritional benefits. For nutritional benefits, that table which you are seeing right now, table 4.3, on that you can just read about it. You don't have to remember any values here. Okay, you don't have to remember any values here. You just have to form your conclusions. Okay, for example, if you take water, Water content is highest in breast milk, human breast milk, as compared to any other milk. Energy content, it is highest in buffalo's milk, because generally it has highest amount of fat. Highest amount of energy content will also be there in buffalo milk. Okay. Protein content, again, buffalo milk has the highest protein content. Carbohydrate, again, buffalo milk has the highest carbohydrate content. So if you compare these three milk, you can understand where does the breast milk stand. Okay. As compared to carbohydrates, proteins, immunoglobulins, etc. Next is your hormonal and growth factor. In detail, they have given about the carbohydrates, protein, and lipids. But if you just look at the table, okay, instead of reading that paragraphs, if you just look at the table, you will get the snapshot of it. Okay, if you want to go in much detail about, you just want to read it like a novel, then you can read the paragraphs as well. Okay. But the information is very much same. What you find in the table, it is much more easier to understand. When you have a comparison also, it is something that your brain can retain. It can retain in your memory. Then hormones and growth factors. Breast milk is a very rich source of hormones as well. For example, TSH hormone, thyroid stimulating hormone, thyroxine, parathyroid hormone, corticosteroids, calcitonin, okay, erythropoietin. Erythropoietin is required for RBC formation, red blood cell formation. Erythropoietin is required. Oxytocin, growth hormone, okay, insulin, prolactin. So growth hormone releasing factor is present in breast milk, so that will help in the growth of the child. Okay, so all these hormone and growth factors are present in the breast milk, so that's how it can regulate the hormonal balance and growth factor of the child. And then immunological benefits. Breast milk has macrophages. Macrophages are the WBCs that can engulf the bacteria or any other foreign body that enters into the child's system. Okay, they can just completely engulf that foreign body and digest it and destroy it. So that is the purpose of macrophages. So these macrophages are also present in breast milk. Lymphocytes. Lymphocytes are white blood cells. Okay, it is present in blood. It is responsible for a lot of immune mediating systems. Okay, the way how your immunity responds to an external threat. Okay, so for that, lymphocytes are important, T lymphocytes and B lymphocytes. And T lymphocytes and B lymphocytes will be made in the child's body as well. But for the initial stages, the enough amount of T lymphocytes and B lymphocytes to keep the child free from infection, not to wait for the thymus gland to produce T lymphocytes. The initial form of T lymphocytes is given to the child from the breast milk. Then immunoglobulins, these are defensive proteins. Proteins which are on defense, they are specifically made to target a specific kind of infective bacteria or virus. So these are immunoglobulins. So because of the presence of immunoglobulins, we say that breast milk is the first form of immunization that the child gets. IgM, IgG, okay. These all are the different forms of immunoglobulins present. Lactoferrin and the vitamin B12 binding factor. Lactoferrin, why? Because too much of iron, if there is too much of iron in the child's system, it can lead to infection. Too much of iron in the system can lead to infection. So the presence of lactoferrin is a binding factor, is a protein binding factor. So, this is able to attach onto the excessive amount of iron, ferrous ions present in the system, and take it away. Okay, so that the child is free from infection. Too much of iron can lead to certain infections. Then psychological benefits. There are other factors as well in the textbook. You can go in detail. They have mentioned lactobacillus binding factor, that is the lactobacilli found in the stomach. Okay, and enzymes like amylase, lipoprotein, okay, lipase, bile salts. These are the enzymes which will help in the digestion. Okay, enzymes are required for digestion, so these are also provided through breast milk. Fatty acids, monoglycerides. Fatty acids, we know essential fatty acids are present in breast milk, human breast milk, for the brain and nervous system, central nervous system development. Psychological benefits. as soon as the child is being breastfed, along with the emotional bonding that the mother feels towards the child also has a sense of security and belongingness to the mother, because it is said that for the first 6 months the child thinks that the child itself is an extension of the mother. Okay, the child does not think of itself as something that is different. Okay, only after the 6 months of age, that's when the child has that maturity to understand that okay, it has a separate body, it has its own hands and feet. Okay, it is the child is its own person. Okay, this kind of perception comes only after 6 months. So for the first 6 months the child thinks that it itself is an extension of the mother's body. So that separation anxiety and all, it is much visible in the children who are less than 6 months of age. Okay, so if they do not find their mother nearby up to the first 6 months of age, that's when the child develops a separational anxiety and all. It can lead to some other kind of psychological traumas or some other insecurities later on in life, attachment issues with other relations in their life. Okay, this can happen if the child has experienced too much of separation anxiety because of the absence of mother in the first 6 months of life. Okay, then economic benefits, you do not have to buy any external things to make sure that you are breastfeeding well. It is even though if a woman is having really good diet, okay, she's having a really good lifestyle diet and all, but still because of her genetic factors, she may not be producing enough amount of breast milk. Okay, that is completely psychological factor. Some mothers, they have this innate fear of not being adequate enough for the child. Okay, these are some psychological situations created in the mind of the mother that could suppress the breast milk formation. Okay, but otherwise economically speaking, you do not have to invest on anything apart from good nutrition, apart from a basic balanced diet that most of the population can afford. Okay, even with the help of certain aids given by the government. So we will discuss about that as well for when we go to the chapter of lactating mothers and all. We have seen a lot of Pradhan Mantri Ayojanas and schemes are there to help with the nutrition of the mothers. Okay, so there are a lot of economic support given to the mothers. Okay, which will not prevent them from being malnourished, and if they are nourished well, there is no other investment, no other money has to be spent to produce breast milk. Okay, you can take the child anywhere, traveling, not traveling. Okay, whenever the child is busy, if the mother is around, she just have to give the breast milk. It does not require any other specific settings or some other technologies. Nothing is required. So this is the most economic way of providing nutrition to the child. It also has a positive impact on decreasing the infant and child morbidity as well as mortality. Morbidity is the rate of disease conditions. Okay, the child who is breastfed well, we see that that child suffers very less rate of infections. Okay, as compared to the child who is not breastfed and the child who is formula fed. Okay, those children tend to have higher rate of contracting infections as compared to a well breastfed child. Then mental development, the DHA is an essential fatty acid that is present in the breast milk, is essential for the brain cell division and neural division as well, and so because of which brain development takes place, and even for the central nervous system development, breast milk and the essential fatty acids given by breast milk is important. And exclusively breastfed kids, even if they're preterm, even if it is a preterm baby who is exclusively well breastfed, okay, they have tend to show higher IQ levels as compared to and cognitive abilities as compared to the preterm babies who were on formula diet. Okay, so is it clear about the advantages of breastfeeding? Environmental advantage, making when the breast milk is being produced, does it create any toll on the environment? For example, when you do mass farming, mass agricultural farmings and all, okay, a lot of investments, a lot of vehicles, a lot of every farming has its carbon footprint in some or the other way on the environment. Okay, but breastfeeding is the kind of nourishment and nutrition for which there is no carbon footprint at all on the environment. Okay, it is safe for the environment as well. To make a formula feed, to have that industry functioning, the kind of resources that go into maintaining that industry, package is required, plastics gone into maintain the formula feed. Okay, it has a toll on the environment. But when you compare it to breast milk has absolutely no toll on the environment. Okay. So apart from that, there are some other specific developments of advantages of breastfeeding for the infants. So the child who has a very strong sucking reflex, okay, when the baby is born, even if you put your small fingers into the baby's mouth, the baby will immediately try to suck on it. The child who has a very strong sucking reflex, okay, the sucking reflexes can be rated from mild, moderate to adequate. Okay, so the child who has a very strong sucking reflex, it is seen that they have a very well developed jaw and teeth. Okay, even in the teeth, we have seen the child who has a really good sucking reflex and breastfed well, the child will not develop crowding in the teeth, because crowding the teeth after a few years, after the before puberty or during puberty, the kids have to undergo braces and all, okay, to correct the crowding or to correct any misalignment of the teeth. But the child who is well breastfed, these kind of issues do not arise, and they also have a very well developed jawline. Okay, it is sterile as well. You do not have to wash any utensil and wash any utensils in hot water, etc. Sterilize them and then give it to the child. Okay, breast milk itself is sterile if the mother is not infected. If the mother is not undergoing any infection, breast milk is considered as sterile. Or the mother is not taking any specific medication that can impact the quality of the breast milk, it is considered as sterile. And reduced risk of asthma, otitis. Otitis means inflammation of the eardrum. Okay, that is otitis. So children who suffer from ear pain and also well breastfed children will not suffer from these situations. Reduced risk of otitis and respiratory tract infections as well. And low danger of incorrect formula feeding. When you are making a formula feed, you have to be very specific about the amount of water used, the teaspoon of formula that you have used. Okay, you have to be very correct about it. You cannot do any mismanagement in that, because it will affect the gut health of the child. Okay, if you feed too much or you have given the child watered down version, the child will not be adequately nourished. If you have given too much of formula feed, okay, the child will have some GI issues, diarrhea, constipation, something like that. Okay, so there is no danger of over nourishing or undernourishing the child with breast milk. And it also reduces the chances of allergic reaction. Okay, human milk protein does not cause any allergy. Cow milk protein can. Okay, buffalo milk protein also can cause allergy, but so far we do not have any cases registered in which the breast milk protein has caused allergy in the infant. Okay, and low rate of sudden death or sudden neonatal deaths in children who are breastfed, and low rate of any sodium, too much of sodium that is excreted in the urine. And the temperature of the human milk is fresh, and it is right temperature for the child to thrive on. So all these points they have mentioned on page number 70. Those who have the textbook, on page number 70, some snapshots of point has been given. You can just go through that. It's a complete meal. Breast milk is a complete meal. It is always ready. Okay, as long as the mother is there with the child, both are together, the meal for the child is always ready with the mother. No need for any preparation, and there are no leftovers or anything that goes into wastage. Advantages of breastfeeding for the mother. Immediate advantage, that is within that first 42 days. Okay, the first 42 days after delivery, it could be vaginal delivery or it could be C-section delivery, any form of delivery, immediately for the first 42 days, you have to be very watchful about the mother's health. Okay, majority of the maternal deaths takes place during this first 42 days. Okay, this is called the puerperium period. Okay, the first 42 days after delivery. So immediate advantages that happens to the mother after when she initiates breastfeeding is uterine involution. The uterus that just imagine a situation in which if it is a woman who is not pregnant, a non-pregnant woman, her uterus is around 100 grams, okay, in weight, 100 grams in weight. But a woman who has just now delivered the child on the day of her labor, she has delivered the child. The size of the uterus is around 1 kg, approximately 900 to 1000 gram. That is a very general statement. It's not exactly 1 kg for every mother. That is very subjective, but approximately. So just imagine from 100 gram to 1 kg. That's how the uterus has expanded. Bigger, it has grown bigger in size. Hypertrophy, hyperplasia, this all has taken place in the uterus. So it has to go back to its pre-pregnant state. It will never go back to the exact pre-pregnant state. It will never go back to the exact pre-pregnant state, okay? But almost there. If it was 100 gram before pregnancy, after pregnancy, when the uterus goes back to the normal size, it could be around 120 or 150 gram, but it will never be the exact pre-pregnant state, okay? So for uterine involution, for the uterus to shrink and try to go back to its normal size, okay, breastfeeding is important. Only when the breastfeeding happens, the kind of oxytocin that the mother's body is releasing, okay, because she also feels that happiness and joy when the child is the child is getting nourished through her. It releases oxytocin, and because of that, the uterus immediately goes into a shrinking stage. That's how uterine involution takes place soon after pregnancy. And because of that, when the uterus is shrinking, the bleeding that happens, the postpartum bleeding that happens, that also reduces. Okay, reduced rate of infection. Lactational amenorrhea, that is the entire that 6 months or 8 months of phase when the child is being exclusively breastfed, the mother will not suffer from menstruation. Okay, the mother will not have menstruation. So that is lactational amenorrhea. When the mother is lactating, she will not have menstruation. It's also a natural birth control. Okay, lactation is breastfeeding is also kind of a natural birth control. Reduced adiposity and weight reduction happens. Okay, reduced postpartum depression, because but still there has been cases where even if the mother is breastfeeding, postpartum depression will still take place. Okay, it's completely subjective. Postpartum depression is a very subjective scenario. Okay, but the chances of postpartum depression reduces with exclusive breastfeeding. Reduced stress, anxiety, and improved body image also sets in. Long-term effects: reduced risk of breast cancer, ovarian cancer, or endometrial cancer. Endometriosis, that is growth of the endometrium. Endometrium is the tissue that women shed on a monthly basis. What you call periods, what you call menstruation, it's the endometrium that women shed on a monthly basis. So this endometrium, which the woman has to shed on a monthly basis, this particular tissue should be found only inside the lining of uterus. But when this lining, endometrial lining, is found in other places of the body, for example, ovaries, fallopian tube, in some cases intestines also. Okay, intestine also in severe cases of endometriosis. Okay, so this uterine tissue is found in other parts of the body, that is called endometriosis. Diabetes, osteoporosis, blood pressure, cardiovascular diseases, any metabolic syndromes, arthritis, Alzheimer's disease, multiple sclerosis. Okay, these are the long-term benefits. These diseases, the risk of these diseases will be reduced for a mother who has practiced absolutely exclusive breastfeeding soon after the delivery. So breastfeeding during illness, okay? In which are the possible stages when you can breastfeed? It is possible to to continue the breastfeeding with appropriate medication and treatment. Okay, even if the mother is suffering from disease conditions like insulin-dependent diabetes, lupus, multiple sclerosis, hypertension, hypothyroidism, Crohn's disease, colitis. Okay, in all these inflammatory diseases, etc., and even in certain infection like TB, hepatitis, breast abscess. Okay, mastitis. In such situations as well, breastfeeding can be continued. Okay, and if she has certain infectious diseases like rhinitis, viral fever, she has to take the appropriate medication. Along with that, she can continue the breastfeeding. Okay, when the medication is going on, when she is getting the treatment for the infections, along with that, breastfeeding can be continued. But it should be discontinued only if contraindicated, because certain medications which have the tendency to cross over through the breast milk and reach the infant if the mother is put on certain medications like chemotherapy, drugs and all. So in that case, the mother has to not give the breastfeeding. In that particular days, the child will be formula fed. And also when it comes to AIDS, in case of AIDS, if there is no caretaker, or if there is no way in which the child is able to get breast milk through a human breast milk bank, okay, in such cases, there is no other option than the mother who is suffering from AIDS has to breastfeed the child. Okay, but if there are other caretakers or agencies involved in the well-being of the child that is born to a mother who has AIDS, okay, they can take over the breastfeeding through a milk bank. Okay, or through other mothers, they can take care of the breastfeeding, because there are chances that through breast milk also AIDS can be transmitted to the newborn child. Okay. So breast milk is the most easily digestible. It is the best pacifier. It meets all the demands and gives immunity to the child. It's in case of a sick child and the child is not doing well, breast milk is the best nourishment and best remedy for the child. So this is the Infant Milk Substitute Act of 1992. Amendment was done in the year 2003. So why this act came into existence? It is because of this act that if you go to any hospital, any maternity hospital or any pediatric hospital, you will not see advertisements of formula feeds. Okay, this act basically curbs the hospital or any healthcare agencies from advertising about the milk substitutes, breast milk substitutes like formula feeds, lactogen, and all those things. Okay, so it provides a regulation for the production, supply, distribution of infant milk substitutes, feeding bottles, and infant food. Okay, under no circumstances, no hospital authorities, no doctors, or no public health authorities should be promoting or promoting the marketing or advertisement of these items. Okay, it is ensure this act has come into existence to protect and promote exclusive breastfeeding and ensure the proper use of infant food. Infant food is only indicated when there is an absolute necessary and there is no other way that breast milk could provide nourishment to the child. Only in that case, other kind of infant food is used, or it is given a chance. Okay. So it was enacted in June. It was amended in 2003. It was put into practice, enacted on 2nd June 2003. So it prohibits the promotion of breast milk substitute products on the pretext of distribution of educational and informational material, which means even by distributing pamphlets or any prints or in newspapers, okay, in such even the display of any flex or any ongoing TV advertisements, okay, this has to be put into it should not be practiced. Okay, so that is the, and even if you go to any hospitals, you will never see the display of these lactogen, or you will not see see the advertisement of these milk products or substitutes even in pharmacies. Okay, they are not supposed to do that. Okay, so that is the main use of Infant Milk Substitute Act. It is just to promote exclusive breastfeeding, because in India we have a tendency that what we see the hospital promoting, we automatically think that is the best version, that is the best thing that you can do for the child's health, and you may completely forget about the importance of breastfeeding. Next is the issue of low milk production. Okay, so generally, in most of the cases, mothers do have enough amount of breast milk supply. Okay, but there are certain specific situations where that would lead to decrease in breast milk supply. So first is ignoring your health. If you are stressed, or if you do not take care of your nourishment, okay, not your nutrition, or you are suffering through any major health crisis, okay, that could also lead to reduction in the breast milk supply. Too much caffeine, okay, too much caffeine could also cause irritability in the child. Okay, smoking, taking certain medications, uh, health related medications or other drug abuses, stress, not watching your diet properly. Okay, these are the general reasons which could lead to low milk production. Certain mothers, like they may dislike the dislike the idea of breastfeeding. Okay, or they are not comfortable about the idea of breastfeeding. Okay, and if the child is not having a proper sucking reflex, or if the child is having a is not having a good latching response, in that case the mother may feel disencouraged. Okay, and also because of tiredness, usually new mothers are, most of the time they are tired, they're sleep deprived, they're tired. So these are discouragements. Okay, these are discouragements that has to be understood and treated well. Okay, contraceptive pills, mothers who are on contraceptive pills, diuretics, who are undergoing severe malnourishment. Okay, so these are also the reasons what could lead to low milk production. About the breast milk bank, so it's a concept that not many hospitals are yet to accept. Okay, so in India, the first institute of the breast milk bank was seen in Chennai, and slowly in the metro cities like Kolkata, Udaipur, etc., they all have established their own milk banks. It has to yet reach other parts of India as well, the concept of milk bank. Okay, so the how it is stored. Okay, if you are going to use the breast milk in the next 24 hours, refrigeration is more than enough. But if you are able to freeze the breast milk, okay, you can freeze it for the next 6 months. Okay, or up to 8 months also you can freeze the breast milk. And when it is going to be used for the next 24 hours, you do not have to freeze it, you have to refrigerate it, and you have to use it within 24 hours. Okay, so that's the policy which is used in the breast milk bank. So according to WHO and UNICEF, there is a baby friendly hospital initiative. All the hospitals which have obstetrical and gynecology department, okay, wherever a birth do take place, they have to incorporate this baby friendly hospital initiative. Actually, it is 10-point, it's a 10-point policy. Okay, in which exclusive breastfeeding is promoted. Okay, as soon as the child is born, what kind of health education has to be given, what kind of nutritional education has to be given. Okay, the importance of exclusive breastfeeding. Okay, the guidelines of it, guidelines of latching. Okay, these all things are summarized in 10 points. And when the hospital is following all these 10 points, it is said that the hospital is adapting the baby friendly hospital initiatives given by WHO and UNICEF. Okay, so that's a brief about baby friendly hospital initiative. You do not have to study about the entire 10 points, but if at all you are interested, you can just search about baby friendly hospital initiative on Google. You will get that 10 points. Okay, but these 10 points are something that the hospital can practice, not you as an individual. This is something that the hospital has to put into practice in form of giving education guidelines and a focus area for exclusive breastfeeding to be practiced. For example, having a breastfeeding room in every hospital, okay, is also a strategy that has been took recognized under baby friendly hospital initiative. So it makes sure that every hospital should have a specific private area where breastfeeding mothers can go in their privacy. They can encourage breastfeeding. Okay, so that is just one example. Coming to artificial feeding, in which all cases do we have the option of artificial feeding? So children who are born with congenital lactose intolerance, okay, like phenylketonuria. When we go to the chapter of inborn errors of metabolism, we will study in detail about phenylketonuria. Okay, so in that situation, it takes around 1 month or 2 months to diagnose it. And children who suffer from phenylketonuria, they cannot be put on breast milk at all, or any form of milk, not even cow's milk, not even buffalo milk. Okay, anything that has lactose cannot be given to the child. Okay, so lactose free plant based milk is usually given to these kids. So any child who is born with this congenital lactose intolerance, like phenylketonuria, galactosemia means, again, galactase is an enzyme that is supposed to break down galactose. Galactose is present in milk. Okay, so in the absence of this enzyme, due to various reasons, the child's body is not able to produce the galactase enzyme. So there is no way to cut down to metabolize galactose. So excess amount of galactose is circulating in the bloodstream. That is galactosemia. Okay, so in that case also the child has to be put on formula feeding. Maternal drug intakes like anti-cancer drugs, anti-thyroid drugs, antipsychotics like lithium. Okay, for if the mother is suffering from depression and all, so lithium could be given to her. Ergo derivatives, that is, ergo derivatives is to maintain the migraine issues. Okay, iodinated radio contrast. This is used in nuclear medicine. Okay, in majority of the nuclear medicines, if the mother is suffering from cancer and she's undergoing radiotherapy. Okay, so in that situation, she may be put under iodinated radio contrasts and all. Okay, so in that case also, breastfeeding cannot be continued. The child has to be put on artificial feeding. And HIV, if the mother is suffering from HIV, artificial feeding is followed. Next, coming to low birth weight babies. So in India, we do see at least 30% of the children who are born come under the low birth weight categories. Okay, by definition, any child who has a birth weight less than 2.5 kg is called a low birth weight baby. Okay, so 30% of the children born in India, they come under this particular low birth weight category, under 2.5 kg. Extremely low birth weight baby, under 1 kg. Very low birth weight baby, under 1.5 kg. These are the classifications of low birth weight babies. Okay, the care for the low birth weight babies is done in the NICU, neonatal intensive care unit. Okay, the feeding and the kangaroo mother care. Okay, all these situations are followed in the NICU. Pallida feeding is followed here because in most of the cases, the low birth weight babies will not be having a strong sucking reflex that could initiate breastfeeding. So the child will be put on pallida feeding. Pallida is a specific kind of spoon. Okay, it's like a small bowl with a protrusion, and either the expressed breast milk or the expressed any lactose formulation or any formula feeds will be given to the child. Okay, so the child does not have to suck, the child only have to swallow the feed. Okay, so if a woman, when she is planning to get pregnant and her weight before pregnancy or during the time of conception is around 40 kg or she's less than 40 kg, there are high chances that the woman will give birth to a low birth weight baby. Okay, so 40 kg is the cutoff mark. So if a woman is trying to conceive or she's approaching the family planning era, so this health education has to be given. Her weight has to be above 40 kg, approximately at least around 45 kg. She has to maintain the weight and only after then she has to go for pregnancy. Otherwise, there is a high risk of giving birth to a low birth weight baby. And also teenage mothers and mothers who are married early, okay, and mothers who have given lots of birth, okay, they have given birth to 4 or 5 children, high parity mothers, okay, they have given lot of births. Mothers who have a very short height, okay, women who are less than 150 centimeters or 155 centimeters in height, that is short height, less than 5 feet 3 inch and all, okay, they come under the short stature category, and who do not have a good weight gain during pregnancy. Okay, these are the situations that could lead to low birth weight babies. So when is the baby considered preterm? A baby is premature, or also known as preterm, when they are born at or before 37 weeks of gestation. Okay, so any child who is born before 37 weeks of gestation is considered as a preterm baby. Okay, maximum 38 to 42 weeks is considered as the ideal range of a healthy pregnancy. If it is 37 weeks or less than 37 weeks, it's a preterm baby. So if the baby is born before 28 weeks, they are considered extremely preterm. The chances of survival is will also reduce. Okay, the more the child is preterm, the earliest the child has been born, there are high chances of the child being successfully viable throughout the first year of life. Okay. So if the baby is born at 28 to 32 weeks, they are considered very preterm. And if the child is born at 33 to 37 weeks, they are considered preterm babies. Okay. That's a classification of preterm babies. Next, coming to the feeding problems in infants. Preterm babies, nutritional requirements has been given, but we should not be discussing that because that's a clinical management side. Okay, the nutritional requirements given for preterm babies, it is exclusively practiced in the clinical setting in the ICU. Okay, so that will not be the focus of the nutritional dietetics course here. So feeding problems in infants, tooth decay, and if the child is not breastfed properly and the child has been given too much of sugary flavored food items, okay, instead of less sugared or breast milk, there are high chances the child may suffer from a lot of tooth decay in the future. Underfeeding, if the child has a lot of relentless crying and failure to gain weight adequately, okay, and if the mother's breast milk has a low fat quantity, okay, the child will be underfed and weight will not be put on adequately for the child, so it will affect the growth and development as well. Lactose intolerance and diarrhea. Lactase, if the child is born with lactase deficiency, that could lead to lactose intolerance. So bloating, diarrhea, and other gastrointestinal problems will follow. And if the child is breastfed in at unusual timings, okay, if the child's hunger schedule is not maintained, the child is breastfed at an unusual timings and all, it could lead to mild diarrhea. Constipation, artificial feeding. If you continue with artificial feeding, there are high chances of the child suffering from constipation, too much of artificial feeding. And colic. Colic is a term which we use for abdominal pain. Usually it happens because if you are not burping the child, okay, after breastfeeding, you have to keep the child in an upright position. You have to tap the back of the child and you have to ensure that the child burps. Okay, burping has to take place. Otherwise, it could lead to gastroenteritis and abdominal pain, and that will keep the child up all night, keep the child crying. Okay, that will lead to other distress in the child as well as in the mother's health as well. So that is colic. Next, coming to weaning. So the definition of weaning is a process during which the infants change from full dependence on breast milk and to a complex independence from it. Complex independence means you are not completely taking away the breast milk. Okay, you are not completely taking away the breast milk from the diet. You are still continuing the breastfeeding, but along with that, you are adding some more other food elements. So this is the weaning process. Okay. So from full dependence on breast milk is the first 6 months. The complex independence from it is the after 6 months. Okay. So for weaning, you can follow this strategy for the 4 to 6 months of age. Why 4 to 6 months? In Indian diet, okay? This will not apply for any other country. The reason being, if you know what is the Anna Prasanna, okay, or it's a tradition in which the child is fed solid food for the first time as a holy gesture. Are you aware of that? It is something that Hindus follow mostly in India. I'm not sure about other religions, but Hindus, they follow this. It's a big event like Annaprasna and all. Yeah, for the first time when the child is given food, it is given in the temple. Okay, it's a ceremony. It's a big ceremony and all. So for that purpose, the Georgian calendar is not used. It is at the age of 6 months, the child has to be given. Yeah, when the baby becomes 6 months of old, but this 6 months of old baby, it's not the Georgian calendar, not the January, February. They follow the Hindu calendar, in which the months are much shorter. Okay. It does not align with the Georgian calendar, the Hindu calendar months. So that is the reason why within 4 to 6 months, this kind of pureed food has to be started, because once you start the weaning diet, even in the temple, you have started the weaning diet, post which you have to continue introducing that specific kind of diet again and again. Okay. So because we do not follow the Georgian calendar, the January, February kind of calendar for such functions, such poly functions, that's the reason why we have given the 4 to 6 months of range here. Okay. In some cultures, as soon as the child has turned 5 months of age, even by the Hindu calendar, if the child has turned 5 months of age, this ceremony is conducted. Okay. In some areas, it is 6 months. In some areas, it is 5 months. So that's the reason why 4 to 6 months is given. But otherwise, from an international point of view, for the first 6 months, that 6 months includes the Georgian calendar, that is January, February, March, and all what we follow, or the dates and all today. Okay, according to that Georgian calendar, 6 months of exclusive breastfeeding has to be followed. That is an international statement, but in India, it could be 5 months or 5.5 months, sometimes 4 months. Okay, based on the ritual timings and everything that people follow here. Okay. So single ingredient pureed food and cereals has to be used, means not too much of mixture has to be used. Okay. If you are using carrot, okay, boil the carrot, mash the carrot, put some salt or some ghee and give it to the child. Single ingredient. Okay. Not you are not mixing mixed vegetables, mixed dals. Okay. That is not used. Take any one single ingredient, add some cereal as well, puree it, boil it, puree it, mash it, and then feed to the child. Okay. Dal, rice, cereal, pureed fruits, vegetables, banana, apple, cauliflower, carrot, these can be added. Fruit juices are the best option here. Okay, you can start with fruit juices. Slowly, you can increase the consistency of it. First, you can start with something that is watery, coconut water. Okay. Yeah, you have to add salt. Okay. You have to add, once the weaning has started, salt can be added. Okay. Because the iodine content from the breast milk may not be enough, and also the iodine content from these food may not be enough. Okay. So that is the reason why you can start with fresh fruits, fruit juices. Okay. And slowly after that, salty things can be added into the diet. And for the next 6 to 8 months, simple bite-sized finger foods can be added. Eggs, khichdi, meat, puree, porridge, these can be added. Sugar can also be given. There is no issues with that. Sugar can be given. Only if the child enjoys sweet. Okay, only if the child enjoys the taste of sweet, because it is very subjective. Some kids do not like sweet much. um, they like something that is sour, spicy, or bland. Okay, so based on the child's preference. But if the child enjoys sugar, and if the fruits are on the less sweet category, it's not ripe up well, you can just add a teaspoon or half a teaspoon of sugar. Okay, and 8 to 10 months of age, this is when the teeth has started to erupt. Okay, even by the 6 months, 7 months, teeth will erupt. So that's why you can give bite-sized finger foods. Okay, you have to be very sure, very careful about the bite-sized food, because the child should not choke on it. Okay, that's a hazard. Semi-solid foods with texture can be given: fruits, vegetables, seafood, tofu, paneer, chicken, yogurt. Mild spices can be added here. Not the strong pungent ones. Mild spices can be added. And then by the age of 1 year, the child food that requires more chewing. Okay, because now that you have to focus on the child's jaw development. Okay, so food that requires more chewing has to be introduced. Pieces of fruit. First it was just bite-sized fruit or finger food. Now it is pieces of fruit and vegetable. Chapatis with dal, dosa, sambar, soup, scrambled eggs, these can be added. These are just an example, but you can see how we are inching towards more and more complex diet by first year. It's not that by the 6 month of age, this complex diet has to be added. Okay, something that you can follow throughout all this feeding diet is sprouted ragi. You can take ragi, you have to sprout the ragi, dry it, uh, uh, sprout the ragi first, and then dry it completely, sun dry it, and then grind it. And this sprouted ragi is a really good source of calcium, iron, minerals, protein, because it's a sprouted one, not the regular ragi. You have to sprout it. Whatever cereals you are going to feed to the child, ensure pulses and legumes that you are going to feed to the child, ensure that you use the sprouted version. Okay, because that will make sure the growth and development is good. Specifically, if you are following a vegetarian diet. If you are following a non-vegetarian diet, definitely non-vegetarian food like eggs can be involved in the feeding diet. But if you're a vegetarian, add legumes and pulses. You have to sprout them, sun dry them, grind them, make a flour of it, and then you can give it in the form of porridge. Very easy to digest and have. Okay, something that does not even require chewing much, but you can make sure the child has enough amount of it. Problems in weaning: obesity. There is a tendency that if the child is eating, if the child continues to eat, mothers will think that, okay, the child is still hungry, okay, the child is not full, and you continue to feed the child more and more. That leads to obesity. Okay, obesity in infants is also something that real, it happens. So that is about obesity. Too much of food, too much of feeding does not mean health. Okay, underweight issues: when too less of the food is consumed, the child has too much of tantrums, does not eat well. uh, Underweight issues can be seen. Food allergies, food sensitivities, and specifically it could be towards eggs, cow milk. Okay, cow milk allergy is also something that is very commonly faced in children at this age. Lactose intolerance, it is very rare. Specifically in Indian children, lactose intolerance is rare, but still it could come up, and in that case you may have to stop the breastfeeding, or you may have to stop the other lactose based formula feed, and non lactose based or lactose free formula feeds has to be introduced. Refusal to take new food: and if this behavior continues, you have to make sure that a proper schedule is fixed. And when you are adding new food items, do not add all the new food items together. Okay, one week once one kind of food you can add. You have to be very patient. Okay, and it should be added in such a way that the child does not identify it as a new food. Because if you are giving a pureed kind of food, the child will not identify something new. Okay, You have to first mask the new food, because you have to ensure that the nutrients are taken. Slowly, when the child develops in the understanding, emotional understanding, week by week, new food can be introduced. Do not add new food on a daily basis, or in every meal something new has to be given. That's not the case. If the child has an issue with new food, it has to be strategically planned. It has to be, the parents have to be very careful in adding new food. It should not come in the eyes of the child. It has to be masked in some other food components, and then slowly you can add new food when the child develops. Choking, this is a very common. Choking and aspiration both is something that is very common. Aspiration usually leads to issues of pneumonia, okay, and choking, if the bite-sized food is too small, okay, that could lead to choking hazards. So you have to be very careful about this. When you are feeding any bite-sized food to the child, do not leave the child alone, okay. An adult or a caregiver or a parent should always be there when the child is sitting with any bite-sized food item that could probably lead to some choking hazards. So the child should not be left alone with food in such case scenarios. Diarrhea, if the proper hygiene is not maintained, even by the caretaker, mothers who are not washing their hands properly, food that is not prepared in a clean environment, the child's utensils, if it is not cleaned or washed well in soap water, and then it is boiled well, okay, because for children, usually you will use stainless steel articles. Do not settle for any plastic cups, mugs, etc. As much as possible, go for stainless steel versions, because stainless steel utensils are antimicrobial. They do not promote the growth of bacteria much. Stainless steel articles, okay, utensils. So try to encourage the use of more stainless steel articles for your child's health. Don't indulge more in plastic or other items. Even applies for silicone items as well. Okay, so that the hygiene is practiced. Okay, hand washing has to be like the parents have to do their hand washing in front of the child before they eat and before the child is being fed, so that positive identification of a good hygiene practice is identified by the child. They will also try to mimic the same thing for themselves. Okay.